Good morning and good evening. It's good morning for those in Uganda, good evening for those in America. Uh, my colleagues in uniform, I salute you. James William Mugeni is my name, and I'm here to do day two review. The outpatient departments in most health centers, 3 and 4s, and hospitals are becoming empty. I hope termites don't build in the health centers like we saw termites build in schools during the lockdown of COVID-19. Yes, actions have continued almost all districts of Uganda. Destitution is setting in some districts. There has been a response from a BIM RDC with threats to the allied health professionals. Of course, that is an AK-47 in mind. Bwana RDC from Abim, this is not an AK-47 war. This is a war of syringes and needles. Pick a syringe and needle and come to hospital and talk to us, and talk to allied health professionals, and talk to health workers. Yes, I think as the institution sets in, we expect to see more actions from the allied health professionals, because it appears we are not yet, the impact is not yet felt. Why do I say that? Nobody in parliament, today I was trying to follow Parliament of Uganda, nobody is yet talking about the industrial action of health workers. Nobody. So the people are not affected. The people are not yet affected enough to consult or to contact their leadership. And as usual, we have dispensable people. We have dispensable people in Uganda that people don't care. Yes, I think one time I was talking about dignity in dying, and that happened during the time we flew Honorable Jacob Olanya to USA, Washington. I said that was an opportunity that I wanted to use at that time to speak, because you need such circumstances to speak about Uganda. Getting a microphone towards yourself in Uganda is a very difficult thing. Yes, so far so good. I encourage my colleagues in uniform to continue. Of interest, I will tell you this. There are people who drive media in Uganda, the likes of Tamale Mirundi. If Tamale Mirundi is not yet talking about hospital, then no, we are not effective. Tamale Junior has not yet talked about hospital, then no, we are not yet effective. Wisdom Kaye has not yet talked about hospital, that means we are not effective. Full figure Jennifer has not yet talked about hospital, that means we are not effective. But that said, that's a bit unfortunate. If those are the people we think should speak for us, it's our time to speak. How did they come to occupy the media space when we are not there? I was looking at the Twitter account of nurses. There are only 85 nurses, and yet there are almost 1 million nurses in Uganda, and their Twitter account has 85 nurses. I think similarly, it's the same thing with the allied health professionals. Yes, I saw New Mulago. The anesthetist didn't report, so surgeries closed. I expect it to be the same in all other hospitals. But that said, leadership should wake up. Leadership should not threaten allied health workers. The picture that you see, if you see the destitution, those poor people, those are people that are left to us health workers always to man. When we cover them, you don't see. So it is high time right now that the cameras focus on all hospitals and the institution brought to leadership, so that people see what we handle as health workers. It is us who act as a buffer. It is us who cushion for you the destitutes that you don't see. And you're in parliament, and you're in leadership. Yes, it's now time for reckoning. The poor people must know that we represent them, and that's why we are standing up. We are not standing against them like the RDC BIM is saying. We are trying to speak out so that people listen. Yes, my colleagues in uniform, I salute you. hoping to see actions of day 3. Thank you. James William Mugeni, a medical clinic officer and a frontliner. I salute you.